What is a cervical facet joint block? Well, a facet joint are these little joints in the neck that help us move and twist and bend our neck. That's what allows us basically to have this full, almost 180 degrees of motion side to side, look up and down all the way, and be able to turn side to side as well. But unfortunately, these joints can develop some arthritis and eventually develop pain. And this pain can even radiate all the way down in the shoulders, into the shoulder blade area. And it's usually worse when we try to make these movements of looking side to side. A lot of patients say, I can't check my blind spot while I'm driving, or it's hard for me to look up. Those are the two most common issues when you have facet joint pain in the neck. So what do we do for this? We always try to start with conservative care first. We'll get you into some physical therapy that we have right here at the Cantor Spine Center. We'll try some anti-inflammatories, maybe a muscle relaxant to try to calm everything down. Because if people know they have neck pain, it can be really tight, all, kind of sit in the neck and really make it so you can't have much motion at all. If this conservative therapy doesn't work, the next step is to do a facet joint block. And how do we do that? Well, we don't block the facet joint itself, we actually block the nerve that goes to the facet joint that's telling you have pain, that's also telling these muscles to tighten. So how do we do the injection? You come here to Cantor Spine Center on another day, you're here for about an hour total from door to door. You'll first talk to our nurses, you'll talk to our MAs, they'll go over the consent, they'll go over all the risks. They'll put an IV in just to give you some fluids. There's no sedation or no antibiotics through there, just to give you some fluids to help you out from getting you dizzy or anything. It's always good to be hydrated during these procedures. Then we bring you into the procedure room. You're lying on your belly, usually with your face down, and we'll have you turn to one side or the other based on what side we're working on. We usually work on one side at a time. We can't do both sides at the same time. That's a little too much to undergo in one sitting. So if we're working on the right side, we'll have you turn left. If we're working on the left side, we'll have you turn right. And that really opens up that space for us and lets us get the medication where we want it to go. We then target right where that medial branch is using the x-ray machine that you'll see. It's over you. It shows me where I'm going millimeter by millimeter to put exactly where I want to be with that medication, with that numbing medication, to block that nerve and block that joint. So we do the procedure. We'll have you come back to the post-op area. You'll tell us how you're doing immediately after. A lot of patients, sometimes this numbing medication kicks in pretty quickly. You'll say, yeah, I can actually move my neck a lot better. We see you back 1 week later in the office. During that week, we'll give you what's called a pain diary, and you tell me what's better, what isn't better. Say, yeah, I'm able to turn my head to the left better, but to the right, it's not better, and we'll go over all that. Usually, as long as you're doing 80% better from the first set of injections, we'll repeat the injections one more time just to confirm that we're in the right location. If these injections work twice, the next step is to do something called a radio frequency ablation or rhizotomy, where we use the same needles, we go down, same type of needles, we go down in the same areas, but instead of just putting medication in this time, we put a little wire through those needles. It attaches to a machine, and we'll actually burn these nerves or cauterize these nerves that go to the facet joint to get rid of that pain for good. Then you get your range of motion back. You're able to get back into therapy and really work on the muscles of the neck to try to keep this from coming back. That rhizotomy will work 6 to 12 months on its own, but if you get back out there, start moving your neck, you can keep this pain away, and we don't have to repeat it later on.